Hey everybody, welcome to the Dr. Mom Show. This is Dr. D, mom of 3. How are you doing? Hope everybody's doing okay. As you can see, we are having a legit thunderstorm going on right now. So you may see a little lightning action and hear a little storming in the back. All the babies are cuddling up with Matthew right now. They're having fun under a whole bunch of pillows and some comforters, just hanging out in their little fort with daddy while mama's trying to give some medical information so we can keep you up to date and you posted. I hope you had a good week. And once again, this is a Dr. Mom Show. It's an educational show by me, Dr. D, also known as Dr. Musielak. I'm a dual boarded internal medicine physician and pediatrician. And really this show is just to provide you with some medical information so you can have a good source that when you go to a physician or you take your child to a physician, you know that you at least can ask some questions and kind of just help you know what to talk about and what to expect at certain visits. Please remember that this does not take the place of what your physician says or the advice your child's physician gives you. So this is just, again, educational and to help. Don't forget to subscribe to the Dr. Mom Show's channel. And don't forget to comment if you have a topic that you want me to cover and you would like to know more information about. So tonight is a topic that I really like. We're going to talk about developmental screening. It's more, whoa, did you see that? That was pretty bright. If I get electrocuted, it will be on video, so we'll see what happens. And today, when we talk about developmental screening, what that is just a way that physicians, we use it for a lot of things, not only for children, but also for adults. And screening tests or questionnaires are just items that as providers we use them to see if there are patients who are high risk for things. So for example, if we do a screening test for speech delay, that helps us to pick up the children who would be at a higher risk of speech delay, so we can send them to get therapy. And in that case, anytime we talk about speech, usually we want to get a hearing test to make sure that that's normal. So usually in general, pediatricians or family medicine physicians, those who see children, that was another big one. Ooh, it's getting real. The babies are definitely not going to be on this video because they are hiding. Screening tests that are used for kids are developmental screening tests. So some big ones are one that is called Ages and Stages that is used. Sometimes either your pediatrician or their staff will go over the questions, or they may give it to you at the visit prior to the visit, that they will go through those questions and answers to see how they're developing. So for example, one of the big questionnaires that we do, and usually one of the first ones is at 9 months, that we use the Ages and Stages. Again, that's just one screening tool for development. There's several. And usually that can be given at the visit prior, which is usually a 6-month checkup. So you have some time at home to watch your child or your children and see if they're meeting those milestones. And again, these milestones include things like communication, social skills, gross motor skills, which are bigger motor skills like walking, sitting up, crawling, and then fine motor skills. So things like picking things up, which we call a pincher grasp. So if your kids have those little puffs or yogurt melts, that they're picking them up on their own and gnawing on it. So those are things that are gone through, and the big ones are usually at 9 months, 18 months, and 30 months. Those are usually the bigger questionnaires that we really make sure we go through to see how the children are doing. In one of my previous shows, I have a a series of videos about autism or autism spectrum disorder. And in there, if you watch those, I talk about autism screening, which is done, one of the most common screening tools used is the modified checklist for autism in toddlers, or we call that MCHAT. Whew. And that is normally done at 18 months and is repeated at 24 months. And again, the reason and the importance of these screening tools, again, is so that we can have early detection of patients who we feel could be at risk, or it also helps with early intervention. So for example, if we feel that a patient has a speech delay, as I mentioned before, normally we send those patients for a hearing test, a formal hearing test, to make sure that their hearing is normal. And then if that is normal, we send them for speech therapy, because research has shown that earlier intervention and being more aggressive with that does help for a better outcome. So for example, if you have a child who at, let's say, 2.5 or 3, we realize that their speech is a little delayed, they're not saying as many words that they should be saying at that time, and we send them to speech therapy versus waiting until they're 4 or 5 and start school, and then at school the teacher is saying, hey, they're behind compared to all the other kids, or the parents realize it at that time, you know, that child will already be behind if they haven't done speech therapy. And again, at least the child who started speech therapy at 2.5 or 3 would most likely be caught up and do fine when they're 4 or 5. So that's why it is important. Again, just to reiterate, this again is why it's important to always keep your appointments and checkups, because this is a way for pediatricians and family medicine doctors to keep track of how your child is developing. And again, we highly rely on parents too and what you tell us. So please remember that these questions are important, of how your child has developed since the last visit and what all are they doing. And it is an exciting time, because I think it is fun to tell people what your kids are doing. You know, they're finally walking, they're sitting up, all the new foods they're eating, when they start solids. So it is exciting. If we do suspect that a child has some sort of delay, as I mentioned, we usually refer depending on what the delay is. So for example, if it's motor skills, they can get referred to physical therapy or occupational therapy. I already talked a little bit about speech delay. Again, if we feel that there's an increased risk or suspicion for autism spectrum disorder, as I mentioned in my other show about autism spectrum disorder, we usually refer to a developmental pediatrician who does a very, very thorough assessment. So this concludes my video about developmental screening. I hope you enjoy it. I hope this encourages you to keep your children's appointments, and even yours, because we do a lot of screening tests for adults also. And please, please, don't forget to wash your hands, kiss your kids, love your family, and say your prayers. Don't forget to subscribe to our channel. In addition, don't forget to check out this week's Thursday Tripsy treat. It's rather fun. We always put these kids to work. Sorry that they couldn't join us tonight because they're underneath pillows and stuff. But I hope you have a great night. I can't wait to see you. And I'm still working, I promise you, working on our Tripsy Travel Adventures video for you, so you can enjoy that. And again, have a great night. We'll see you later. Bye-bye.